All right, hello everybody. My name is Dr. Jared Bonaquisti, and I'm a physical therapist at Kinetic Physical Therapy. And if you've been following along with our lectures here, we've been talking a lot of shoulder disorders, starting with rotator cuff, we went to the labrum, and now we're going to move up to the AC joint. So if we're looking here over the objectives, right, we're going to review the bony anatomy of the shoulder. We're going to learn about the AC joint, what it is, what are the functions, learn the types of AC joint sprains that there can be, learn about the way to diagnose an AC joint sprain, review the research for conservative management right over surgery, and then we're going to talk about a few exercises that you can do if you're focusing on improving that AC joint pain there. So first thing we're going to do is look at that bony anatomy of the shoulder. So if we look at this top right picture here, first thing we need to know is the AC joint itself. So if you're looking, it's between the clavicle here and the acromion here, right? That joint together is called the AC joint. So if you're looking on the back of the shoulder blade, we have the acromion as it wraps around, which turns into the spine of the scapula. Then you have the scapula itself, which is this big bony structure here, the head of the humerus, and then the humerus here. Okay, so these two connect, right, to form your glenohumeral joint, and then you have at the top your AC joint, right, that acromioclavicular joint. Looking at the picture down here, now we're adding in some ligaments into it, right, so you can kind of see how the structure is going to come together. We have our acromioclavicular ligament, which again connects the acromion to the clavicle, and then we have our other ligament structures here, which connect onto that cord process right through here. So what is the AC joint? So a joint that connects the clavicle to the acromion and connects the shoulder blade, right, to the rest of the skeletal system. So we say that because the shoulder blade itself, even though it runs across the rib cage, is not actually attached to any bony structure. So literally your shoulder blade is attached to the rest of your skeleton through this joint here, right, through the acromion, which connects on the clavicle, which then connects onto your sternum. The AC joint itself may or may not have an articular disc with the capsule, and the ligaments of the AC joint, if we narrow them down, we have the acromioclavicular ligament, and then you have the corticoclavicular ligaments, and then those two, the conoid and the trapezoid branches. Types of injuries that you are going to see, we have our sprains or our separations. You can have synovitis, meniscal tears, right, of that articular disc if there is one there. Arthritis, just like any joint, you can get arthritis, and then fractures. So most common that we see in the clinic, at least in my time as a physical therapist here, are you're going to see your sprains and your separations. So if we're looking through the grades here, we're going through grade 1, 2, and 3 to start off. Those are the most common. So grade 1 is just a partial tearing of some of the fibers. It's an AC sprain, it's what it's dubbed as, and you're not going to see that step off or that instability. Grade 2 is a complete rupture of some of the fibers. That's where you get into your AC separations, right? And then you're going to have some instability and a mild step off. And then the grade 3 is a complete rupture of the AC and the corticoclavicular ligaments, also known as an AC separation or dislocation, and a considerable instability and a step off. And what they mean by a step off, if we look at this picture down here, is you feel the top of your shoulder, right? It almost feels, unless you've had an injury like this, it feels like it's just one straight plane, and then there's a little bit of bone on the edge, and then it comes straight off. In here, in grade 3s, you'll actually feel your clavicle, right in the front, this bone goes all the way to the edge, and then it almost feels like there's a step down. And then you get to the edge bone, and then it comes off. So that's what that step off is. That's something that in physical therapy, right, when we are looking for AC joint sprains or we're dictating what we think the severity and the grade is, we look for this step off as part of our palpation of our patient there. So AC joint sprains, separations continued. So there's new research that indicates that there are 6 total types of sprains. 4, 5, and 6 all require surgery because they are more severe dislocations with displacement of the clavicle, whether that be, anterior, posterior, right, inferior, superior. And then types 1 and 2 if we're looking at the research, right, have recommendations that have conservative care is more effective than surgery. Type 3, this is where we get into that gray area where it depends on the doctor that you have. So some doctors will indicate that they want to do surgery right away. Some will try the conservative management first, but there's strong evidence to support conservative care for type 3. But with the displacement of the clavicle, it may be necessary to treat with surgery. And then again, it also depends on the patient's activity level. If you're a grade 3 and you're not that high level of an athlete or don't have that high level of activity, conservative management is probably going to be more beneficial than if you're a Division I pitcher who fell and hurt their shoulder. Grade 3, it's definitely going to require surgery to fix and then get back onto the field. So the mechanism of injury. Most AC joint injuries occur when a person falls onto or has a high energy impact to the affected extremity. The scapula and the AC joint are connected to the rest of the body, right, of the shoulder girdle and skeleton via the AC joint. And while impacted may translate the scapula medially, superiorly, inferiorly, and the clavicle will stay relatively still due to its firm connection to the sternum. So what that means is as you have an impact, your shoulder blade and the acromion are going to move and shift. But the clavicle, due to the stability of that connection here, is not going to move as easily. So you're going to have that translation there of those two bones separating, sliding, medially, inferiorly, or superiorly as you make contact with the ground or somebody hits you. So signs and symptoms. Pain and tenderness, right? That's going to be along the anterior and superior, right, to the front and the top of the shoulders. You could have pain at the base of the neck, right? Whether that be kind of more laterally or can also be anteriorly because of where that SC, so where the clavicle and the sternum meet, that injury could affect the SC joint as well. So that definitely needs to be looked at if you're going to physical therapy for. And then along the lateral aspect of the shoulder, along the deltoid, and it's tender to palpation along the AC joint. Like we said earlier, if you're having a step off, that's going to be where that point of pain. Restriction in motion, you're going to have pain with reaching across the chest, reaching overhead, behind the back, and if you're carrying any heavy objects due to the translational force there that you're putting on the AC joint. And then sleep. Sleep can be disrupted when laying on that side, usually because of positioning of the arm when you're trying to lay on or when you're trying to push yourself up in the morning or to roll over. That can be a lot of pain, a lot of stress right on that AC joint. So let's review some conservative management. So the AC sprain and separations, right? While performing research on AC joints, sprains and separations, a clinical review published in 2018 was found, which stated that evidence is lacking to support various methods of rehabilitation. This was written in note due to no randomized controlled trials being updated. So what's that mean? Obviously, people get treated for this, but there's been no good, solid evidence to dictate that this is the best way to treat an AC joint sprain grades 1 through 3. Most evidence and most of the anecdotes in there, right, as we stay in the last sentence here, was best practice based on expert opinion. So people in the field talking about what they've done, things that they've been successful with, and using available literature on, all right, this is what we've done, and this is how people have progressed, this is what we've accomplished, and so on and so forth. So not having those randomized controlled trials, which is best way to look at evidence and say what is effective, using expert opinion is our best practice so far. It consists of protection of the AC joint, pain control, activity modifications to kind of limit the stress on the AC joint, progressive pain-free strengthening to start off, and then range of motion needs to be restored right to the opposite limb value. So if you can get 180 degrees with one arm, you need to be able to get 180 degrees of the other side. So that's what they strive for, taking it nice and easy, and again, going pain management way, or at least pushing into pain a little bit, but we don't want to push so much that we have a regression in symptoms. And then at discharge, we're looking at shoulder function should be symmetrical for strength and range of motion before discharge. So when you're doing your manual muscle testing, you should have equal strength on both sides and equal range of motion, or at least as close as we can get. So looking at some of the research here, right, one research article noted that patients who underwent surgery, right, surgical management for a grade 3 had no significant difference in outcomes when compared to conservative management of the same degree. So this means that you're going to spend X amount of dollars to do the orthopedic doctor, to get the injections to start off, to pay for the copay for the surgery, maybe if you have a deductible to hit that number, all to have no significant difference between doing conservative management and physical therapy. This is where I feel like we need to look and review as physical therapists and as orthopedic doctors here. Because yes, there's definitely a need for surgery at times. Absolutely, right? We can't deny that there are certain things that physical therapy cannot repair, cannot heal. But we're overusing the surgical interventions here. And while we're seeing that conservative management is just as effective in a lot of cases here, especially for, in this case, grade 3 sprains, which they looked at. So surgical management, it was noted that patients who have a type 3 sprain or greater will undergo surgical intervention and may take up to 6 months or longer to reach rehabilitative goals. Due to a lack of blood supply to the ligaments of the AC joint, that may delay healing. Healing of bone fractures takes at least 4 to 6 weeks. If it's more displaced or the fractures have different angles or different sides, it may take longer. And then hardware implementation, right, to fix those fractures, that all takes a long time. And you're not usually allowed to start rehab until the doctor gives the all clear, which may be 6 weeks. So now you're talking surgery, lack of blood flow, maybe 4 to 6 weeks, right? So everything can heal the way that the doctor wants, and then you start rehab. You run the risk of complicating factors such as adhesive capsulitis, arthritis of the joint due to lack of motion, or just decreased in soft tissue mobility because of this. So again, sometimes it has to happen, but for the most part, if we can have conservative management be, we would rather use that than have surgical management. So looking at a conclusion, right, it's hard to say really at this time, right, due to the lack of strong evidence using randomized control trials for conservative management. We know through expert opinion recommendations on where to start, which we're going to go over in a second, and grades 1, 2, and 3 can be managed conservatively. Surgical outcomes were not more significant when compared to conservative management for grade 3 sprains. So right now we're on the fence that if you have a grade 3 sprain, we'd rather you get your conservative management first. Like I always say, the surgery, the injections, all of that will always be there. But being able to heal, repair, rehab before you need something as traumatic as a surgical intervention is always recommended, in my opinion, because I think that's the way that our body wants to heal and the way that we need to heal. So going through some exercises here. All right, one of the big things that we need to work on, especially early on, is rotator cuff strengthening. Due to an injury, a lot of times we'll have inhibition of those areas, right? That rotator cuff muscles are right in that area there. And usually when we're talking about glenohumeral stability and whether we're getting superior translation, are we hitting that joint, the AC joint? There's a lot of factors involved. So rotator cuff strengthening is always recommended. Scapular strengthening, especially scapular retractors and depressors. Serratus anterior activation, right? Allowing for proper upward rotation of the scapula so that we're not stressing that AC joint any more than we need to. Those are all going to be recommended exercises, and there's a variety of ways that you can do that. If you look online or you come to Kinetic Physical Therapy or you go to another physical therapist, they'll have definitely different strategies on ways to activate those muscles to allow for that proper range of motion. So if you need help or you have any questions, please contact Kinetic Physical Therapy or any physical therapist that you feel comfortable with or that you've had before. All physical therapists right out of the gate, once you graduate, can assist you with AC joint disorders. So, by all means, please go there first and reach out to your physical therapist first, because these problems can be solved a lot faster than getting surgical interventions and possibly being out for 6 months or more. If you're looking for any more information, you can go to our social media pages. You see our Facebook, Instagram, and YouTube page there. This presentation here will be up on our YouTube page and our Facebook page soon, once we can kind of put it all together. And then if you need any information from me, there's my email and our work phone number, which they can contact me and I can reach out to you. So if you have any questions, please reach out. Other than that, I hope that you found this informational and you got some good education out of it.